Hi YouTube, it's Simon Hollissey here, and today I'll be talking about my hair transplant. It's been 4 weeks since I had the surgery, and this video is to give viewers the opportunity to follow my journey, and over the course of the year I'll be uploading more videos so you can see my progress. Now, if you are suffering from male pattern baldness, I suggest that you follow the link which I'll be posting down below and will probably be popping up on the screen along here as well. Follow that link and it will take you to one of my previous videos where I talk about the different products and medication I personally take along with thousands of other men in order to help combat hair loss. Now, if you are thinking, I want a hair transplant, most surgeons will not operate on you unless you're over the age of 25, and they'll always insist that you are on some form of medication, because if you have a hair transplant and you're not on medication, the rest of your hair is going to fall out and basically it's not going to look very good. So, you want a hair transplant. The first thing you should do is go online and obviously type in hair transplant clinics. There'll be a whole list of different places you can go to, whether you want them abroad or in the UK. Now, I personally went with the UK hair transplant clinic. If you go on YouTube, you can see lots of videos of celebrities that have had it done there, and I thought that was the right place to go to. Went along and you have a free one-to-one with one of the guys there, and basically they'll draw in a new potential hairline and estimate how many hair follicles you'd want. I would require about 1,200. We also discuss the different procedures. There's FUT and FUE. FUT is where they take a strip of skin from the back of your head and then they cut into the skin and take the hair follicles out and then just pop them in where you need them. Problem with that is it leaves a very fine scar, and if you're like me and an actor who's going to be playing different roles with shorter hair and stuff, I didn't want that scar. So the other option is FUE, a bit more expensive but scarless, and FUE involves taking the hair follicles out individually from the back of the head and then place them into the front. Now, you'll be given a pack of what you should and shouldn't do. So 3 weeks before, if you're having FUT, you'll have to massage the back of your head 3 times for 3 minutes every day. For 2 weeks prior, you're not allowed to smoke or drink or eat spicy food. This is mainly because when you're having the surgery, it's something to do with your blood, and it will cause more blood to come through your head, and then that can affect your outcome. So no smoking, no drinking, and no spicy foods for at least 2 weeks. And you're not allowed to have any anti-inflammatory drugs, so like ibuprofen, and you're not allowed aspirin. The only thing you can take are paracetamol tablets. Hello, well, it is the 21st of September 2015, and tomorrow I'm going to have my hair transplant. So I'm just going to make a video just to show you very quickly what I'm actually having done. So if I push my hair right back, you can see, I'll go from this angle, I'm having all of this area along here filled in, and along here as well. I will upload a few photos to show the line before as well, but it's late, it's like 12 o'clock now, and I need to be up in 6 hours to catch the train to the clinic. So I'm going to shoot off the bed and I'll see you tomorrow morning. See you soon. And it's the 22nd, it's 8:30, and I'm about to go in and have my hair transplant, so I'll see you in a bit. Here nice and early at the clinic. See you in a bit. On the day of the actual surgery, you have to wash your hair normally, but no conditioner or lotions or anything like that. You'll go in and you'll meet your surgeon. My surgeon was a Dr. Hassan Noreen, who was very nice. You'll go into his office and he'll draw in the new potential hairline, measure it all up to make sure it's all okay. And then you'll go upstairs, and you won't be allowed to have a t-shirt, you have to have a button shirt, because if you take it off after you have the procedure, you can rip all of the hair follicles out. So make sure on the day you're actually having a button shirt. What they do is they'll shave the back of your head, which you'll see some pictures coming up in a minute, so it will look very silly if you choose, like me, to not shave the rest of your head, but I didn't want that. But generally speaking, they'll shave all of your hair off, and that's from the technicians. So you have your 2 technicians there, your nurse and your surgeon. Once they've shaved it all off, you'll then lie on sort of like a massage chair, so your head's like lying between this like little circular bit, and they'll take an injection and put the general anaesthetic in. With the general anaesthetic, it literally barely any pain, just some little pricks, and it goes all numb. Then what they do is they'll take the hairs, follicles from the back of your head. You won't feel any of this once you've had the general anaesthetic, so it's completely painless. Take that all out. Takes about 2 hours. That's probably the worst part because you're facing down for those 2 hours. You might get a bit of a headache and stuff, but nothing other than that. Once you've had that done, your surgeon will then come along and will make incisions into the top of your head of where you actually want that done. So put a general anaesthetic into the top of the head, and then a separate injection, which I believe separates the skin from the scalp, just basically gives a bit more area underneath so that they can make the incisions. Now when you get that injection, it literally feels like you've got a heavy hat on your head, and I remember for about 2 days or so I literally felt I had a hat on my head, but that's all it is. I think that's the bit everyone's worried about, I think, when it comes to hair transplants.
Is the pain?
Yeah, but it's been fine.
You need to bust it, yeah?
Yeah, but I think once the actual stuff goes in, like you don't feel anything.
Can you feel that?
No, that's fine.
So it's more painful in the front here, but we'll take it slow. Is that painful then?
No, it's fine.
See, it's quite slow.
Yeah.
If you do it faster, it's more painful, yeah?
Yeah. Can't feel anything.
Because as you can see, I'm injecting very slowly, yeah? Is that painful in the front?
No, it's fine. We don't even know anything's going on there.
Well done.
No, it's fine.
Okay, so this way.
Yeah.
You will see in a minute, yes. You will feel like you're wearing a helmet. That's how most people describe it as. This combined with the numbness, that's how it feels.
Yeah. Okay, yeah, I think it feels that.
Pressure.
Yeah.
So if you call tumescence solutions, just hardening of the areas and lifting up the scalp. Yeah?
God, yeah, I can feel that.
Yeah, can you feel that?
Yeah. And what's the purpose of that? So that lifts the skin up, did you say?
That lifts up the scalp so that the incisions we make, you can make more incision for one because you're increasing the surface area,
Yeah.
the density, and next is you're lifting the skin away from the deeper structures, the vessels and such, so less trauma to the deeper structures. Yeah, if you lift up the skin, it's fluid.
Yeah.
Because the fluid is absorbed easily by your body. So
So once they've made the incisions, the technicians will come along and they'll pop all the hairs into your new area, your new hairline. Overall, that took about 5 hours, and you get a little lunch break in there as well, so not very long at all, and you're ready to go home at the end of the day. And that's all it was, just literally 5 hours to have the procedure. When you get home, you'll have a pack with you from most surgeries. So the first thing you'll do is you have to sleep up for the next 7 days. That's mainly because of the swelling. After the pain's gone down, the swelling's going to come up, and you're going to see that in some of the photos I've uploaded. So sleeping upright with a travel pillow, that's also to stop you lying on your side and brushing any of the actual hair follicles out. They also give you some steroids, which will help with the swelling. You take those for 3 days, if I remember correctly. So it was something like 7 tablets per day, and that will bring all the swelling down. There's no massive amount of pain. I think over the course of 5 days I took about 5 paracetamol tablets, so it was a very pain-free procedure.